Welcome to another episode of Well Beyond Numbers. I'm your host, Dennis Coral from Coral Well Management, and we continue the conversation with Dr. Ray Tolmos. And Dr. Ray, you share so much information some of it has gone above my head. I don't know some of the acronyms because it's not my industry, but I want to know more about your practice. And if somebody's looking to fire their old primary care and look to work with you, I'd like to know more about what is your steps and how you do what you do. I think I mentioned offline that one of the reasons why I switched from my primary care was because I used to see him at noon in my lunch hour, and every time I would go to see him, it was lunchtime, and the nurses would also order their lunch at the same time, and they would order rice and beans, and we're in Miami, so they're all the things that the doctors
Right.
don't tell you that you should be eating, they were ordering it.
Yeah.
And then I go to see my doctor, and every time I looked at him, he looked bigger and bigger and bigger.
Just
So
growing.
I figured that
Yeah.
maybe this is not the doctor for me. I may want to see a different doctor that maybe focuses more on more holistic.
Right.
Um, that's really not common.
Yeah.
Looking at holistic medicine is not common. It's growing. It's a growing trend in the
For sure.
U.S. now. But if somebody wanted to go and see you because they were tired of their doctor, to look for better results, better services, or improve their overall health, what would be their next step when it comes to working with you? And by the way, I don't know if you can also mention a little bit about your background. I know you used to be a physical therapist as well before, correct?
No, personal
Personal
trainer.
trainer. I'm
Personal
sorry,
trainer.
personal
Right.
trainer.
Right. Actually, initially wanted to be a physical therapist
Okay.
until I went to a chiropractor, and then I was like, wait a minute, that's what I want to do. And that was at 14 years old, as a matter of fact. That's when I found out that that's kind of what I wanted to do for the rest of my life. So, pretty cool story. But as far as my background goes, I was an athlete my whole life, which is how I got into physical therapy and chiropractic, just from suffering my own injuries. And throughout college, I went to Florida State and I got my exercise science bachelor's. So, learning about the body and the anatomy and how exercise plays a role. And I was certified as a personal trainer, and I was a trainer at the gym in Tallahassee. And then I moved back home to Miami, and I was a manager for all of the trainers at an LA Fitness, as I took about 9 months off between college and chiropractic school. And then when I went to chiropractic school, I maintained my job as a trainer at Gold's, kind of working in my off time. And so for me, it's always been about fitness and health and nutrition. And it's just been a part of my life since I was 3 years old playing, t-ball. So it was just congruent for me, and it was just that growth. So when I got into chiropractic school, I was like, I want to do sports chiropractic. I want to be the chiropractor for the Dolphins or the Heat. And then I started learning more and more about it, and I realized, like, there's a lot of things that chiropractic can help with that aren't necessarily sports related. So I got into what's called upper cervical chiropractic, which is only adjusting the first bone in the neck, called the atlas. And the atlas surrounds the brainstem, which is where all of the
It's
involuntary
right here.
function of our body comes from. Right up here. So, you've seen the movies where and people die, right? Well, upper cervical chiropractic is the opposite of that. It's trying to align that bone so that the brainstem has the most room to be able to, it's like turning the faucet on, right? That brain connection goes right through there, and every nerve in our body is connected to every cell in our body, and it sends messages up and then sends messages back down. And stress affects this area. So if we can adjust that area and keep it healthy, we're balancing the nervous system in that manner. And so I was able to help people with back pain, with knee pain, with just is to help them heal more efficiently physically. So I was walking through a conference one day, and it said, do you see people with all of these things? Do you want to be a primary care provider? And I was like, yeah, because I do upper cervical. I see people with everything, it could help everybody. Is it a cure for anything? No. But could it help people heal from anything? Yeah, it could play a role in that. So that's what I was working on. I was seeing 60 people a day, adjusting their brainstem, and that was it. Or the bones around their brainstem, better said, excuse me. Um, so I get into this conference, and it's all blood work. And I was like, oh, this makes so much sense to me. And little by little, I started learning more about the testing and the approaches taken. And then I ended up doing my certification as a certified chiropractic internist. So my certification is through the American Board of Chiropractic Internists. There's maybe 5 to 600 of us throughout the entire United States. There's probably about 15 to 20 now in the whole state of Florida, and I am the furthest one south. All right, the next closest one is in West Palm Beach. So the focus is to bring together primary care with functional medicine. So when people come to see me, that's exactly what we do. They call the phone, they send us a message on Instagram or whatever. We have an online scheduling system. They're on the schedule, they come in. I'm going to spend an hour to an hour and a half with them that first day. First, why are you here? What symptoms do you have? What's going on? When did it begin? Tell me about growing up. How did you get sick all the time? Did you have any major infections? Any major I try to learn as much as I can about them. Then I'll do a review of systems where I ask them how their body is working from head to toe. As you mentioned, holistic medicine. Everything plays a role. Then we do a very thorough physical. I check the head, ears, eyes, nose, throat, heart, lungs, abdomen, pulses. I may do neurological testing, orthopedic testing if they have any type of physical ailments. And then we put all that together and we decide, okay, what tests are going to help us to find out where these issues are coming from. If it's a physical problem, do we need an x-ray, MRI? If there's something that we palpated in the stomach that seems like it's off, do we need to do a CT with contrast? Or what are we looking for, right? So once we find out all those things and we rule out pathology, number one, then we assess function. And that's where we determine, okay, based on what you're currently doing now, we have these numbers and this data, and you feel this way. What we need to do to change this is develop a treatment plan for you. That treatment plan is going to be this is the type of diet that you need to be on for the next few months. These are the supplements that may help aid your diet because in order to get this one nutrient you're deficient
Hmm.
in, you would have to eat 9,000 pistachios every day and that's not possible. Okay? So the supplements can be helpful in that manner. Or, you know what, your gut is showing us that you're not really absorbing as much as you can from your diet. So we should bypass that and we should do IV nutrition, right? And then once we figure out diet and supplements, exercise. What type of exercise should you be doing, right? How can we physically help your body to improve here? Again, most people are going from doing nothing to something. It takes the body about 6 weeks to acclimate to exercise. So maybe we start them on a certain treatment or regimen, and then we obviously change that as time goes on, and it's always changing. Then from there, we determine okay, what other services do we have that might be helpful? I have an infrared sauna in the office that we use for people that are dealing with detoxification issues, with exposures to mold, those kinds of things. We have certain procedures that we do to help people with sinus conditions, people that have had allergies for years or maybe even harboring infections for years, where I take these balloons and blow them up inside of the nose and help with drainage. And there's a million and one things that we can do for each and every person, which is why we talk about it being kind of primary care. But all of those treatments are dependent on what tests are we running, how is the history and the physical looking, and then what makes the most sense, where do we make the most impact, and then we get to the icing on the cake stuff down the line, where it's like, okay, now that everything's healthy, how do we anti-age? How do we feel as good as possible for as long as possible, not necessarily to extend our chronological time, but to improve our biological health, right? The younger that we can feel, doesn't matter how old you get. That's really what the goal is.
That's amazing. Are there some standard tests that you would do for depending on the age of someone and also the gender?
Right. So a lot of women come to me in their even young 40s, early 40s, and they're like, "Oh, I'm perimenopausal," and it's true. There very well could be some of these major hormonal changes happening. A lot of women come in and say, "Oh, I'm in early menopause." And if they have that in their family history, there's a chance, but rarely is it actually early menopause. Typically, it's going to be some sort of hormone disrupting issue that they have that's going on underlying. I've had women come into me that haven't had periods for years, and then all of a sudden they get their period, and they're upset with me because they were happy to not have their period. But then they're like, oh, wait a minute, this is better for my cognitive function. This is better for my brain health. This is better for my cardiovascular health. This is better for me to prevent osteopenia and osteoporosis. And then they kind of are like, okay, I'm happy it's back.
Yeah, we're in March. Speaking of women, this is Women's Month.
Yeah.
Women Month. We do help in our practice a lot of women, and it's a niche that's grown over the time over the years. Women. Speaking of women in her month, are getting MBAs at a much faster pace than men, are now out earning how much men are making, and also they live longer. And if they were in a relationship, chances are that they'll outlive their spouses.
Right.
So that means that they have to take care of themselves, not only financially, but also healthcare
Right.
wise. So let's talk about women for a moment. What do you feel women should be doing to prevent and improve their health as they age, in your opinion?
Well, it all goes back to looking at the numbers and really looking at the tests. I think a lot of women are asking to get certain tests done, and a lot of medical providers are giving them, obstacles. Oh, you don't need that. You don't need that. You don't need that. Again, I think it's they say these things because they're not really sure how to treat them without putting them on sort of a hormone replacement, right? But there's so many things that can be done, from dietary changes to changes in exercise to uh, hormone optimization itself. So for women, it's really looking at the numbers and then understanding what's affecting them as well. A lot of women are more type A than men are, and that need to be on top of everything and kind of have that control also plays a really big factor in how stress affects them. I see it all the time. Many women handle stress differently than men, and not negatively. It's just a different way that they handle it, and it consumes them many times. And this is a very negative effect on their adrenal glands, which downstream can have a very negative effect on their hormones. It's like it can make their body run through nutrients and things faster. A good example is I tell people all the time, if you're driving Miss Daisy around, you may change your oil once a year. If you're driving around the Daytona 500 race course, you're going to need to change your oil a few times a race. So how hard you push that machine and how hard the environment is pushing you determines, kind of how much nutrient, how much, what do you need? So that's something that we always take into account with women too. What type of personality are they? Have they had any past traumas, anything like that? That can really be affecting them emotionally as well. Because to heal, we need to have all three pillars of that stool kind of there, so we can sit on it and be healthy, which is emotional health, chemical health, and physical health. We can't have two of those only, or we're gonna fall over. We need all three to be strong.
Yeah, you mentioned that in a couple of episodes. Your emotional, your physical, and your mind, and
Yeah,
I agree with all those, and each of them require that you do some type of work. It's not just
for sure.
something you begin now and then you see the results the next day.
Yeah,
It takes some consistency
yeah,
when it comes to that. The
yeah.
same way you would see investment results, it takes time for you to see them. It's not going to happen overnight, but if you have a good plan in place, you just have to follow it.
Right.
Um,
Consistency.
is there any young age or there's an old age? Is there any is there a
Anybody and
time
everybody.
to come see you?
I mean, honestly, the way that I look at it is that everybody should be being seen by a provider like myself if they want to really maximize their health. It the
And that can
met
be at any
at
age.
any age. The medical system at this point is just not preventing our issues. I have a lot of kids who are coming in now that I'm seeing with more autoimmune conditions. I'm seeing 7-year olds with Hashimoto's, which is a autoimmune thyroid condition.
Wow.
So many kids have allergies and attention issues and all these things, and it's all the immune system and gut health. So, I mean, I have kids, as young as a year in the office that we're doing microbiome testing on, and it's just barely finished developing at that point.
Right.
But those stages of development are extremely important. Women are planning more C-sections, right? That natural birth does have a lot of health related, consequences or improvements for kids that are born naturally. The first bacteria that should kind of inoculate our child is lactobacillus from the vaginal canal. When a child is born cesarean, that doesn't happen. It's whatever's on the doctor's hands or in the operating room or on the skin of the mom as they place them on the mom. And that's going to be typically some sort of a staph, or a strep or some sort of other bacteria. That is all of a sudden now what colonizes. And that's going to lead to risk of allergies and attention issues and all of these things. So, for kids, it's super important to help them grow healthy and to help them perform the right way, and to get them to develop healthy habits at a young age. the end of the day, that's what it's all about. I've got 8-year-olds coming in to see me that are obese and overweight, and they can't concentrate in school. And it's like, well, what are you giving them to eat? Well, breakfast is orange juice with Captain Crunch and a Pop Tart. They got zero protein and all sugar, and you want them to be able to sit still in school and concentrate on something, and they're hungry, craving something sweet again. So it's just kind of backwards the way that we take care of our health nowadays. When we're eating healthy, it's called a diet. It's just it's wrong. So helping people, especially kids, learn how to be healthy and develop a palate for healthier foods at a younger age is extremely important. Can you survive off of chicken nuggets and pizza? Yeah. Is it healthy? No.
No. Wow. Yeah, you did mention it. Wow. You're right. You're right. Uh, you lost me out of words, to be honest, because um, everything you say, even if you practice it, it's hard to maintain the consistency.
Yeah, for
I eat
sure.
healthy, and I like to say I go to the gym, I exercise, I check my numbers. Probably not as frequent as I should be, but it's all about maintaining the consistency and leading by example when it
Yeah.
comes to raising healthy kids. And speaking about obesity, speaking about sugars, I asked you this before, but let me just rephrase it. Is it possible to reverse symptoms that you may be predisposed? Somebody's predisposed to be diabetic, somebody's predisposed, or they had a family of arthritis,
Yeah.
or they have family where they have Alzheimer's. That
Right.
happens with people as we all age.
For sure.
Is it possible to reverse? I don't know if I want to use the word reverse, but or maybe
Prevent. Right.
slow down,
Yeah.
because it's inevitable sometimes. Some things that if you're bound to happen, how can we slow it? How can we live a much younger life, slowing things that could happen to us because of our
Right.
genetics?
Right. Well, as I mentioned earlier, genetics are going to load the gun. Okay. But
Yeah.
the environment is really what pulls the trigger. So if we know that everybody in your family has some sort of a condition, what measures can we take to prevent that from happening, right? So, for example, let's say somebody has the gene, the ApoE gene that predisposes them to a higher risk of Alzheimer's and dementia. Well, then we should be making sure that their gut health and their brain health is extremely, good, that they have minimal amounts of insulin resistance, that all of those factors that predispose them to developing these proteins in their brain that block their brain from working the right way, that we can minimize that. Um, Cholesterol, high cholesterol in the family, that's something else too. Okay, what do we need to do? We need to make sure that we're looking at the labs that tell us how this is progressing and then make those changes to improve. And again, supplements help there. Some peptides may be helpful. So knowing what we're up against is extremely helpful. Which is why I love to, know more about family history and even run a lot of genetics within the practice. We have these cheek swabs that we run, which tell us about different what are called single nucleotide polymorphisms, which are like basically little chapters of the instruction booklet of our DNA, which tell our body how to do certain things. The most common one that everybody's heard of now is MTHFR. I actually developed an MTHFR supplement 12 years ago. It just showed up on my Facebook profile.
Wow.
12 years ago, I made an MTHFR supplement, and now it's like the biggest thing. You hear Gary Brecka, the most important test you could take is a methylation test, MTHFR. And it's true to a certain degree, but all it means is that you just need to switch a vitamin. So there's so much stuff that kind of goes into disease and pathology, but knowing what you're up against can really help us to manipulate that environment. And that's called epigenetics, which is something that I've been studying for a long time and apply that by looking at even conventional tests. So that's really cool. But I'll leave you with a kind of a crude joke. A lot of people, that are obese say, look, it runs in my family. But the response is really that no, no one runs in your family. So no, doing the exercise and those things are important. Now, again, obesity is also a conglomeration of multiple things. There's hormones that are involved. It's not just, hey, you need to go exercise and change your diet. There's a lot that goes into that, and medications like the GLP-1s and those things are amazing, but the counseling that needs to be going with those is where there's a huge problem nowadays as well. So many people are on Ozempic and Wegovy and tirzepatide and semaglutide, and they're just eating less of what they were already eating before. So unless they're going to take that medication for the rest of their life, they're going to find themselves in that same exact boat, except probably with a decreased amount of skeletal muscle mass and more uh, body fat when they get back to their original weight when they come off that medication. So that's a huge one that I wanted to just mention there.
Wow, thank you. Yeah,
Yeah,
we didn't even go that route of
yeah,
Ozempic, and
right,
which is now you probably open your email or go on Facebook or Instagram or anywhere else. It's just there everywhere. We
right.
haven't even gone there,
Yeah.
which I'm assuming you're against that.
Yes and no. Again, in the right applications,
Okay, that makes
for
sense.
some people it can be really beneficial, um, but with the right counseling, you can't just
Order it off online that because you see it on an ad.
right, and then you just eat less, which is okay, that's fine, but you need to make sure that you're getting the amount of protein that your body needs to maintain your muscle mass. When you're in a calorie deficit for an extended period of time, your body realizes what's going on and it starts to actually break down your muscle because it costs you more energy to maintain muscle than fat. And
True.
your body wants to preserve energy. So you end up breaking down your skeletal muscle mass, which is why there's the Ozempic face and all that stuff, and people with all the flab because the weight that they're losing is actually healthy weight that they shouldn't be losing. And those drugs with the wrong counseling or not having any counseling can be very dangerous for our health in the long run too.
That's a great way to finish this segment. This
Yeah,
is amazing. So look for a doctor that can help you really with your overall health. Don't really go online
yeah,
and do your own research because you could be hurting yourself.
100%.
Yeah. So hope you enjoyed this episode of Wealth Beyond Numbers with Dr. Ray Thomas. We still have one more episode with him where we're going to talk about things that drive him crazy in his profession. And this has been Dennis Coral from Coral Wealth Management and another episode of Wealth Beyond Numbers. And as we like to say at Coral Wealth Management, financial confidence starts here. Thanks for watching.